Well, coronavirus cases continue to pop up across the city, state, and country.
And right now, officials say there are 44 confirmed cases of the virus here in New York. 5 of those cases in our city. Governor Andrew Cuomo also announcing today that 4,000 people across the state are in quarantine as a precaution, with 2,700 of those people being in New York City. Meanwhile, there are 44 people in mandatory quarantine in New York, 9 of those in the city.
Governor Cuomo announcing today that New Yorkers will now be able to purchase cancel for any reason travel insurance policies.
The Department of Financial Services authorizing travel agents and insurers to offer this coverage after receiving complaints that the policies could not be purchased in New York State. 6 global and national insurance companies have agreed to offer those policies. Many standard travel insurance policies do not cover trip interruption or cancellation due to COVID-19. So this new action gives New Yorkers the right to cancel plans in the future due to the virus.
Well, here in the Bronx, some universities are taking precautions after reporting that some students and staff have been exposed to coronavirus in different degrees.
And the College of Mount St. Vincent says that a student was exposed to someone in late February who later tested positive for the virus. That student now under self-quarantine for 14 days. Meanwhile, a professor at Fordham University is also self-quarantined after officials say their spouse might have been exposed to coronavirus patients. And at Bronx Community College, a student there is under self-quarantine after coming into contact with the virus. And tonight we are clearing up some coronavirus confusion. We have heard from experts on how you get it, recovery time, and who is at risk. But tonight we're also looking into more of this particular strain, COVID-19.
Yeah, News 12 The Bronx reporter Christy Reeder sat down with an infectious disease doctor to break that down for us.
For about 35 years, Dr. Edward Telzak at St. Barnabas Hospital has been looking into infectious diseases, even working with the CDC doing epidemic outbreak investigations. The perfect person to clear up confusion on the coronavirus.
There are many coronaviruses.
Yeah, you heard that right. There are many different coronaviruses. In fact, maybe you've even had it.
The cause of the common cold, the common respiratory infection, there are 4 or 5 coronaviruses that circulate that cause very mild disease.
But there are more serious strains.
SARS was a coronavirus. MERS, Middle Eastern Respiratory Syndrome, both of them had very high mortality rates. That was a coronavirus.
And the latest coronavirus strain is called COVID-19.
SARS, MERS, and this particular coronavirus, COVID-19, are much more pathogenic, much more transmissible, have resulted in certain populations in serious illness and, in fact, in death.
While it can be serious for certain people, Dr. Telzak wants everyone to keep this in mind when talking about the COVID-19 strain.
The overwhelming majority, 90+% of individuals, and even a much higher proportion of individuals who are otherwise healthy, really get minimal disease.
At St. Barnabas Hospital, Christy Reeder, News 12.